Thank you, Sarah and Caroline, for inviting me today. So the remit for the talk today is quite large. We're going to talk effectively to start with on um, general skin health, and then we'll have a little look at various skin conditions that you need to be mindful of. And then I guess we would then move on to what happens really when things start to go wrong with your skin, and finally talk about anti-aging and what products we perhaps should be using today. So if we start with slide 1. Okay, so what is skin? So I guess understanding a little bit about your skin helps you to understand what's happening when things go wrong. It's obviously it's your largest organ in the body, covers your entire body, and proportionally in an adult, it's about 1.5 to 2 meters squared, more in a child. Makes up about 7% of your body's total weight, weighs about 4 kilograms, and obviously suffers from a lot of wear and tear and abuse over our lifetimes. And it has several skin functions. The most important function is really a barrier to water loss. And this is certainly something that one appreciates when one is scalded. And this is a very superficial scald. This child survived, but effectively was very poorly for about a week, getting through the fact that he was losing a lot of fluid from the burn. And this was just a kettle scald. So skin protection, preventing water loss, very important. And as a barrier, it also protects us from ultraviolet light. It protects us from pollution. It acts as an endocrine organ. It acts as a processor for any antigens out there. So the Langerhans cells in the skin are processing any noxious substances that we hit upon. It's very important for thermoregulation. So a hugely important organ of the body. This is a histological slide of the skin. And from the bottom of the slide, that's your dermis. And in the dermis, you have your blood vessels. And this is the skin of someone who's quite young because of these troughs and peaks, these so-called ridges, very important in terms of the consistency of the skin. And you'll notice these little black dots at the bottom of the troughs. These are the nuclei of the cells. And as you move towards the surface, those nuclei are lost. The integrity and the connectivity of the cells reduces until we get to the top of the skin, the stratum corneum. And that's where the nuclei are sloughed off, and the skin that is eventually sloughed off too. And if that rate of progression is increased, that's when you get scaling on the skin. So if any of you are taking a vitamin A, a retinol, or a retinoid, you'll notice that at some stage you start scaling, and that's because you're increasing the journey of the skin cell from the base in the trough up to the surface. This schematic just shows it a bit more clearly, that you have your basal lamina at the bottom with your stratum basale, and this is where the skin cancer injury starts. And then you'll notice that the little bonds between the cells in the next layer, the spinosum, start to be lost further up, and your skin is then, as I say, sloughed off. And that's a natural process. So the skin you have today is not the skin you had last week. Okay, and these are your melanocytes, a very important cell in our body to help protect us from the radiation of the sun. These classically have these dendritic arms, and it's down these arms that the pigment that is made near the nucleus is passed. And the idea of the melanocyte is that it actually drops these little pouches of melanin into the skin to protect us from the sun. And when the sun is stronger, the melanogenesis, the production of melanin, is increased, and vice versa. And as I'm sure you know, there are various chemicals that we can use to increase or decrease the production of melanin, typically decrease the hydroquinones, which affect the melanogenesis and lighten our skin. We have in the trade this so-called Fitzpatrick scale. This is just a way of us, for instance, if you are coming to the spa to have a laser treatment, one of the things that one needs to know about is the sort of skin that you've got. And this is a way of identifying whether or not you're fair skin or dark skin. And the Fitzpatrick scale really allows us to categorize you into an area to allow us to treat you more accurately. And it would be fair to say that those in types 1 and 2 are more prone to sun damage than those in types 5 and 6. And I guess I'm showing you this slide really to say that we, all of us, as we go through life, there are various stages in our lives, and our skin comes under different sorts of attack depending upon the health that our skin has at the time. So if we have looked after our skin, then we are likely to do better than those who have disregarded it. It would be fair to say that the young girl on the left, she has already had, they reckon, 50% of the sun damage that she's going to incur through her lifetime at that age. So it's never too early to start protecting your skin with a reputable sunblock. And then as you move through these different ages of our lives, you'll notice that they all have a slight tan, but they've not gone mad. And I think that's the important thing. I certainly wouldn't advocate you walking around with a hood over your head, because sun is very beneficial to our psyche. But I think one can overdo it, and one needs to be sensible about using a sunblock to protect us from the UVA and UVB. And I think that just brings us down to principally the one takeaway message is that our skin is susceptible to damage, and we call that, it's an oxidative stress. And the skin is damaged by electrons being knocked off the various molecules and atoms within our skin by usually radiation. So 80% of damage to our skin is UVA, UVB. So we're going to focus mostly on that. So by taking away electrons from our atoms, this produces an atom that is able to cause damage locally. So these so-called free radicals then cause damage to surrounding cells. And there are both extrinsic factors that will do that, and you can see here on top left, sunlight, air pollution, water pollution, but also things like diet. This is very important, and we're seeing this increasingly now. And there are some intrinsic factors also that we have little control over in terms of our genetics that make us more or less susceptible to damage. And the whole idea about managing your skin is protecting it, is repairing it, and using products that are antioxidant, that can actually neutralize these free radicals. And they do that principally by adding electrons back into those atoms to stabilize them again. So what happens when it goes wrong? Well, I guess the first thing to say is that we have on our bodies already a variety of moles and areas of inflammation to the skin that we may or may not have some control of. This is just a benign mole on the skin, and that mole originated in utero, and it has moved from what's called the spinal cord, the notochord of the fetus, and moves to the skin. And at a programmed time in your life, it appears. So I often see women who come to me and say, this mole has just arrived on my face. Why is that? And it's because these are programmed events. And so this is an entirely benign mole that may or may not warrant removal. And this is another classic. This is a seborrheic keratosis. And this is commonly on the trunk, commonly on the back and around the neck. And these are very superficial lesions, which can easily be scraped off, leaving minimal scarring. And then we start to move towards those things that cause sun damage. And this lesion here on the side of the nose is a basal cell carcinoma. It has a classic rolled edge. It has these little red lines on, which are called telangiectasia. And this, if you left it, could locally cause harm, but these don't spread, these don't metastasize. So from that point of view, they're the safest thing to have, but clearly needs to be removed. And then we move on to sun damaged areas. This is a solar keratosis. And as we get older, we'll get these principally on sun exposed parts of our bodies if we haven't looked after our skin. And this is characterized by the redness that you can see. You can also see that you've got some increased scaling, and that, as I said before, is due to the fact that the sun's rays are stimulating our basal cells to move through their pathway more quickly. And so the skin cells clump up at the surface, and they aren't sloughed off quick enough, and you get this scaly appearance. Now, these can be treated usually with things like liquid nitrogen. There are some topical agents you can add onto the skin for this. And 5% of these, the reason why you probably would treat these is 5% of these can turn into a frank skin cancer, a squamous cell carcinoma. So, and that's what this is. This is a squamous cell. Again, you can see this is in an old face, so they tend to be age-related. You're more likely to get these when you're older than when you're younger. And this isn't something that you can treat topically, really. Ideally, you want to excise this and close the skin directly. And these do metastasize, so these are important. So keeping a check on new lesions on your face and body is very important. This is another skin lesion which can occur. It's quite frightening because it's quite large, it grows quite rapidly, and it develops this so-called keratin plug in the center. And in fact, this is a benign lesion, often mistaken for a squamous cell carcinoma, but usually treated by removing it, curetting it from in this case, the bridge of the nose. And you're often left with no scar. The classic history is it grows very rapidly and usually involutes within about 3 to 4 months. Then we're looking at, this is a dysplastic nevus. Now, there are lots of younger patients who will have these. They will have more moles in their body than normal, and many of them have this irregular edge with pigment. And they are called dysplastic because these aren't malignant, they don't spread, they don't harm you, but nevertheless they are a worry because they're quite big. And I see a lot of men and women with these conditions, and the journey here really is around careful observation and surveillance by an expert, and biopsy if there is any concern. And they're not to be confused with these, which are melanomas. Now, I guess of all the lesions we're going to talk about this morning, this is the one that you need to be most careful of. This is the one that kills more people, and its incidence is rising. And its incidence is rising, of course, because we're exposing ourselves to the sun more, and our ozone layer has been depleted. The typical characteristics of this mole, you can see, are it has an irregular edge, it has irregular pigment. And there are various types of melanoma, but this is a superficial spreading melanoma and is the most common. it would be fair to say that the incidence, as I said, is rising, and your risk of getting this, your lifetime risk of getting this, if you're a man, is 1 in 36, and if you're a woman, it's 1 in 47. So that's quite significant. So again, surveillance, any concerns, make sure you're checked out by a specialist. And there are things you can do to interrogate this mole in terms of looking at it through a typical, a specific type of magnifying glass, so-called dermatoscopy. And this is often used to determine whether or not the mole you're presenting with is malignant and needs to be further treated. Then I see a lot of these. Again, this is usually, these little cysts are usually seen in men and women with, you can see here, large pores. They have hyperplastic, they have very active sebaceous glands in their skin. And the result of that often is that the duct is blocked and you develop a small cyst. Now, in themselves, these aren't a malignant problem. They can be a problem in that if they get infected, then one can end up with a poor result in terms of the scarring that one gets. So cysts on the whole, I feel, should be removed because the consequences of leaving them are a bit of a disaster. Obviously, these are things that GPs usually reassure patients about, but my feeling is that if you've got a cyst, particularly on your face, they should come off before they get infected. If they've been infected, the consequence of that in terms of the scar is much worse. And then obviously, we manage patients with scars, both in terms of their color and in terms of their lumpiness. And there are many things that we can do now in terms of topical treatments, the use of silicone, the use of IPL, and the use of lasers to manage scars. And sometimes also we have to excise them and redirect their main line of attack to try and improve their appearance. Cosmetic camouflage also plays an important role. Okay, so anti-aging and protection. I think, as I've said, 80% of your injury is through sunlight, so we'll concentrate mostly on that. This is Desmond Morris, who, as you know, in the 60s wrote a book called The Naked Ape. He was less than flattering to half the population of the world, I feel. But one of the things he did say, which I do buy into, is that flawless skin is probably the most desirable characteristic that men and women aspire to. Which is cheap coming from Desmond because, of course, he hasn't fared too well in terms of the way his skin looks. He's aged quite poorly, in fact. But nevertheless, I do believe that aspiring to healthy-looking skin is important because I think it gives us self-confidence, it gives us a good feeling of self-esteem, and it empowers us. So I think it helps our psyche. And all of these things I see regularly on during my daily clinics. And you can see here also that our life expectancy has certainly increased. If you were born after, if you're sort of born in 1930, your chances of survival were about, if you're a woman, you lived to about 60, 62, 63. If you were born in 2010, you've got a life expectancy as a woman of 85. So we are getting older, therefore our load of, in terms of sunlight damage is increasing, and therefore our chances of getting problems with our skin is also increasing, and we need to be mindful of that because that's going to affect our life, our lifestyle, and our health, both physical and mental. Now, it would be fair to say that I don't think they could touch up photographs when that photograph of Audrey Hepburn was taken when she was younger. And I think this is one of the things that is important to understand is that I guess beauty is in the eye of the beholder. She obviously was very beautiful when she was younger, but you would be hard pushed to say she wasn't beautiful in the photograph on the right too. There are some changes in her skin. She was notoriously thin, and unfortunately, people who are thin age more quickly than people who are fat. And people who are thin have thin skin, and therefore she's more prone to, as you can see, fine lines and wrinkles. So there are issues around her neck, issues around her crow's feet and her forehead, but still a very beautiful woman. And I think, the injury she has sustained through sun damage is clear, but I think there is a balance to be made. So when we look at the light, the light we talk about classically is UVA and UVB, and UVB principally. UVB is what burns our skin and causes our sun damage, but there's increasing evidence that UVA also can lead to changes in our skin and the development of skin cancers. Infrared light on the other side also now is being implicated in sun damage and the development of skin cancers. This is a great photograph. This basically shows the ozone layer in the southern hemisphere. And at the top left, you've got 1979. And at the bottom right, you've got the 30th of September 2019. And what it's saying is that little blue area is the hole in the ozone layer in the southern hemisphere. And you can see how it got bigger and bigger and bigger and bigger. And it's gradually, you can see the snapshot in 2019, it's got smaller again. And this was because of the, as you know, the Montreal Protocol in 1987, which banned the use of the chemicals that were causing ozone depletion. And it's been a very impressive, in terms of a worldwide action, it's a very impressive, because we've gone from about 343 tons of chemicals causing ozone depletion to almost zero. So it's been a very impressive effect, but there's no doubt this ozone depletion has added to our risk of injury. Now, one of the things that we do at the spa is to use what's called a Vizier machine. This is a machine developed by a company called Canfield, and it allows us to interrogate your skin. So the idea really is to try and match your treatments to your skin damage. And so there are 8 variables that we look at, and they are listed there on the left. And the idea is that you see your esthetician, she carries out a Vizier test on your skin, and then she advises treatments and products, and then brings you back 3 months later, puts you back into the machine to show that she's improved the variables that that we measure. And I think this has added some really very good science to managing patients' skin injuries. And it's something that I would really recommend, that it's a very personal approach to treatment and something I think works very well at the spa. So having done that, what we're talking about, if you remember, we talked about free radicals. The new term for them is reactive oxygen species, ROS. And this schematic basically shows that they act in many ways, but ultimately result in injury to various cells within our skin that result in the quickening of the breakdown of our collagens and our elastins. So we know that photoaging results in loss of elasticity of our skin, the increase in the wrinkles, and basically the vertical descent of our skin. So what we're trying to do is to repair that and prevent that happening. And that's the whole process of treatment. This slide, I guess, basically just shows you that in the young skin on the left, you have this very deep purple area at the top, the epidermis, with these very marked reety ridges, these troughs and peaks. And if you look at the skin on the right, you can see that the epidermis is thinned and it's lost that the troughs and peaks. And what that means clinically is that if you don't look after your skin and you allow your skin to photo age significantly, the skin is thinned, and that results in an increased ability for it to be injured. And there are conditions, genetic conditions out there. The classic one is a condition called xeroderma pigmentosa, where they start off without these ridges and they have a much higher incidence of skin injury. You can literally push the skin and you can tear it, and they are much more prone to skin cancer generation. So that's a very typical picture of loss of integrity of the skin with photoaging. A quick slide on SPF. Sunblock ranges from 15 up to 50. Some people would argue that factor 50 is probably too strong, but I think properly manufactured it isn't. The most important thing is that it's a broad spectrum sunblock that you're using. So you need to look for that on the tin, as it were, because most sunblocks were initially prepared for UVB, but you need to also protect against UVA. So you need a broad spectrum sunblock, and you can see that the damaging photons with no sunblock on the left, and what sunblock is effectively doing is doing two things. You have mechanical sunblocks, usually zinc based, which bounce the sunlight back off the skin, and you see this with cricketers, don't you, on their noses and their lips when they're out in the field. And you have chemical sunblocks, which effectively absorb these photons, converting those photons to heat energy, which is then irradiated off the skin. So again, one of the things that you must have in your armamentarium is, and you must use regularly every day, is a sunblock. And I think the other thing is, just remember that factor 15 means that you're reducing your ability to burn by a factor of 15 over the day. And so what you must do is, that the common mistake is to apply it just once a day. It should be applied, if you're out, at least 3 to 4 times during the day. It's something you carry with you in your pocket and you apply. Now, antioxidants, that's the real buzzword, isn't it? These can be applied topically, or you can take them systemically, and we'll come on to that in a minute. But the top antioxidants that we talk about are vitamin C, and vitamin C acts both topically, and you can take it as a dietary supplement. But vitamin C on the skin acts by protecting and repairing the lipid layer of your cells. So it's the number one antioxidant, and again an important component in your daily routine. Retinols, again, these are vitamin A's, again very important in protecting you from the reactive species. And you can either buy these over the counter, or you can have them on prescription. And the stronger the retinol that you use, or the retinoids that you use, nearer to vitamin A, the more powerful the vitamin A product is, but also the more likely you'll get scaling, irritation of the skin. So one needs to have your retinol supervised. You need to make sure that your esthetician starts you off slowly and then moves you up as and when required. Vitamin E, again, there are products that contain both vitamin A and vitamin E. And of course, for all of those who enjoy their red wine, resveratrol is very important. And it's the number one reason why you should have a glass of red wine at least 3 times a week. CQ10, or coenzyme 10, again, is normally something that one would take as a diet. And then the flavonoids and polyphenols usually are dietary. There was a big step change in my life at the spa when, out of Duke University in America, a dermatologist there, a very prominent dermatologist there, worked out how to improve the penetration of vitamin C and vitamin E into the skin. And that happened in the 80s. And that was basically the beginning of the so-called cosmeceutical product. So we've moved away now from cosmetics, many of which can be very expensive, but don't have very good penetration, to a range of products called cosmeceuticals, which are much more powerful, need to be advised upon, i.e. you need to seek advice as to which ones to use particular to your skin. But these give you a much better result. And I think it's a very personal thing. So some products work better on patients than others. So it is a little bit of trial and error also. And that's why it's important to be into a program of care. Just as we touched on with your retinoids, it's often quite confusing. If you look on the left, we're talking about retinol esters. These are things that you can buy over the counter. The active product, if you look at this schematic, is retinoic acid. And retinoic acid, we commonly call tretinoin, and that's vitamin A. And tretinoin has to be prescribed. This is on the right. And the closer you get to retinoin, moving from left to right, the more potent the product will be, and the more complications you're likely to get. And so if you buy a mild retinol, you're unlikely to get much scaling. If you have a prescription tretinoin, you will get some scaling on your skin. So it's about trying to find what works for you in terms of a balance. I put these three up because I think really what you really want to know is what should I be using on a daily basis. And I think there are two types of patients that I see. There's usually the lady. I don't see many men. It's usually the lady who gets up in the morning, looks at herself in the mirror and thinks, oh my God, what has happened? And they come into the spa and they say, do something, please. And then there's the other lady who says, I'm going to put aside so much income a month, a year to manage my skin. And they are the better bet, really. So what you want to be doing is you want to be getting into a program of care. And within that program, in terms of product, you need to be using a retinol, and usually use that at night because it can sensitize your skin. The sunlight can sensitize it, so it's normally used at night. I would suggest a vitamin C serum for your skin and a sunblock. Doesn't have to be this brand, doesn't have to be from Naked Health, but if there's one take-home message today, what you should be doing from now on is those three things. Doesn't take a lot of time, but definitely worth doing. And then I guess the next thing I talk about is you might also think, well, should I be doing this topically or should I be doing this as a diet? And I think the answer is you should be doing both. And that's because, so for instance, if we look at these products here, the product on the right, C ferulic, is an ascorbic acid with a couple of other constituents within it. That has very good skin penetration. If you take dietary vitamin C, the skin will be the last part of the journey that the dietary vitamin C will get to. So using both, I think, is what I would recommend. And we've said that taking dietary vitamin C is very important. I take it every day. I take 1,000 milligrams of vitamin C in the morning every day of my life now, as part of supplements that I take. And it is the number one, I think, antioxidant. And as well, obviously, taking it as a dietary supplement, you're also protecting and supporting the gut lining and also the body systems, liver, kidneys, and your vascular supply. So I think doing both is very important. And I think finally that brings me on to functional medicine. I'm sure some of you are aware now that there is a movement towards designing your healthcare and trying to preempt problems that might happen in the future by accurately looking at and measuring you now. So I got into functional medicine about 2 years ago, and effectively what happens is you see a physician, a doctor, qualified doctor, who has taken on and has progressed into this area. And they effectively measure your bodily fluids. They look at your blood, your urine, your feces, and these are all sent off and looked at. And they get back a report which tells you where your deficiencies lie. And they then have a conversation with you as to what sort of things you should be taking orally and what sort of things you should be applying to your skin to protect yourself and prevent some of the conditions that can occur going forward. And there's absolutely no doubt in my mind. I've been doing it for about 2 years now, and I take some supplements in the morning, I take some at night, but they are principally around things like vitamin A, vitamin C. I take omega, I take N-acetylcysteine. So many of the products that are good antioxidants and are cardioprotective, cancer protective, and help my immune system. So I do think there's a very much an advantage about going down that line, and I'd end my talk on just that, saying that I think your skin health is important and topical treatment is key. But going forward, it's not just about your skin health, it's about your total health that's important. So I do think there is a role for dietary supplements too, and functional medicine. Thank you very much.
Great, thank you, David. That was really fascinating, and it's really good to know the science behind it rather than just being told you must use this and you must use that. It's best to know why we should incorporate all of these products and treatments into our lives. So I have quite a few questions actually. So one person asked, the typical cost of the products shown on your slide, they were the retinol, the Abargi, vitamin C, and the SkinCeuticals SPF.
Typical costs range from about £40 up to £100. So they are more expensive than your cosmetic.
And is it one of those things that you get what you pay for or not?
I mean, I think so. I think the brand that I showed you, the SkinCeutical brand, has been around a long time. L'Oreal now own it. It was an independent to start with. Its products, I think, really are based on good science from Duke University, Department of Dermatology. And we've had some very good, we get very good feedback from our patients about it. And I think yes, I think you do get what you pay for.
Do you use vitamin C and retinol at night, or just the retinol?
Just the retinol. So the vitamin C I take in the morning, but the retinol is what you should take at night. Yeah.
And when you say take, do you mean the topical use of retinoid in the evening? And then
so the topical retinol should be at night or when it's darker, because you don't want the sun to cause your skin irritation, because of the retinol will upregulate the retinol's action. So you want to be taking that at night, but vitamin C can be taken during the day.
Thank you. Should you take other supplements to aid the absorption of vitamin C?
I personally don't, and I don't advise that. I think the vitamin C comes, in terms of dietary vitamin C, comes either as the fruit or comes as the pill, and they're both very easily absorbed.
Do you have a functioning medicine doctor that you could recommend?
I do. I mean, I'm very happy to, if you want to email me on any of the emails below, I'm very happy to give you their contact details.
Should you continue with retinols till you get to the scaling, or is it best to stop before you get to that point?
No, I think the teaching is that you need to get to the scaling. What you're trying to do is to increase the transformation of your keratinocytes. You want to get rid and slough off the old skin cells to get back to a healthier set of skin cells. So the basal cell is what's being upregulated in terms of its turnover. You want to increase that turnover to get rid of any cells that have been sun damaged and to get you back to cells that haven't been injured.
One of our guests has got 3 cyst-like swellings on my body, one on the right breast and the other 2 on the abdomen. They've been there for almost 4 years now. Is it advisable to have them removed?
So if they are cysts, the answer is I personally think it is. What you must remember is, of course, I'm a surgeon, so I like to operate. And of course, I only see ladies and gentlemen, I see men with this problem as well, who either are concerned enough because it's got too big to have them removed, or they've been infected. So the reality is I probably see a skewed part of the population. There are probably lots of people out there with cysts that never misbehave. But I guess having seen what it's like when they go wrong, my advice would always be to have them removed.
And you're happy to provide a free consultation after this, aren't you, as part of the offer from today?
Yep, very happy to do that. You would just contact team at Naked Health and just mention that you were part of this talk, and a free consult was offered for a skin check. And I think, you know, if we've got you in the room, the important thing is also to take the opportunity of checking out, you know, if you wish to have a full body skin check.
If you start using the products that have been recommended and revert to others later, do you maintain their assistance, or does it go back to how you were before?
No, I think, no, there's no doubt that if you stop using a cosmeceutical and go back to a cosmetic, then gradually the benefits you've had from the cosmeceutical will go. So what it will do is it will just put you back a period of time, and then you'll carry on aging as you have been before you started your cosmeceuticals.
What advice can you give for keeping greyish skin around the mouth for Asian skins? And what can you do to eradicate this?
Well, I'd have to see it firstly. I don't quite know what that means. One has to be careful with darker pigmented skin in terms of the treatments you have available to you. There would be product, and there would be specific treatments that one could give you, both in terms of energy-based treatments, IPLs and lasers, etc., RF machines. There are a variety of things that one could use, but that would be dependent very much on having a look at what you're concerned about.
And you're happy to do that over Zoom as well, aren't you? If people aren't comfortable coming into the clinic when it opens.
Yeah, again, now if you want to Zoom me, I would suggest you contact info@. So that's my surgical secretary. She has my Zoom account and she could set the Zoom up for you. Again, just mention Really Helpful Club, free consult on this.
Are moisturisers with SPF protection included good, or should you use a separate SPF?
That's a good question. I think you use what you can afford. If you can afford a separate SPF, then I would do that. And most of them have a moisturising component to them.
So this is a question from me, actually, because I use all of this. But what layering, what order should you use your vitamin C, your SPF and your moisturiser?
Right, so I personally would put your vitamin C on first. You want that to go on directly onto your skin. And then if you have to use a moisturiser, the SPF basically goes on last, I think. That's what I would suggest. And if you if it doesn't have a moisture in it, then I'd put the moisturiser on between the vitamin C and the SPF.
Is it good to use face masks and scrubs each week to remove dead cells?
Right, so the whole idea of exfoliation, which is effectively what vitamin A is doing. So tretinoin, or the retinols, is causing a desquamation of skin. It's doing other things too, but that's one of its functions, to increase that throughput of cell turnover. There's no doubt that microdermabrasion or exfoliation is a good thing to do. And using face masks to that end, yes, I would recommend.
If you have one of the tools that are like a scrub, it's like a brush effectively, and you now have them that are silicone, is it safe to use those every day?
Well, that's a sort of question I can't really comment on. All I would say is that using a facial scrub is, I think, a good treatment. One obviously can overdo it and cause injury to the skin, and I think it is always a balance, isn't it, between getting some desquamation and getting too much desquamation.
Can you wear an SPF underneath your foundation or makeup?
Yes, you can.
Presumably that would go on last, then that would go on
Yeah.
after the SPF.
Yeah.
What can be done for acne scarring?
So I'm talking about acne next week. So we have a talk next week on acne scarring, but basically what acne scarring, it depends on whether or not it's active or inactive. If you're just talking about someone who had acne a long time ago and now they're and that's all resolved and you've just got the scars that have been left, then there are lots of things that can be done, both in terms of product, in terms of microdermabrasion, in terms of various mechanical devices that we can use, energy devices that we can use for the scarring. And if they're very bad, then often excising them and suturing them can be of benefit.
So of the factors that you mentioned for SPF, which one would you recommend for daily use?
I must say I tend to suggest anything between 30 and 50. I think 15 isn't enough, and so I tend to go for something in the 30 to 50 range. Most of my surgical patients who I've operated on in terms of facial surgery, they go on to a silicone product for the scarring, and they go on to an SPF, usually of 30 to start with.
So someone's daughter has found a cold sore treatment that seems to help with facial spots. What are your thoughts on using that?
No idea. I don't know what product you're talking about. I can't comment.
Right. Are some SPF brands better than others?
Well, I guess they might be. I guess depending on the product, both the SPF and the base the SPF's put in. We're very happy with, we've got several sunblocks that we use at the spa. We're very happy with all of the ones that we use.
And there's a lot of research going into stem cell therapies being included in creams and topical treatments. Do you think it's worthwhile spending the money on such treatments?
So I would say the following. We have a brand there called Dr. Levy at Naked Health, which we use, which is from Switzerland. The idea, as you know, about stem cell is that it is stimulating cells within your own dermis that are quiescent to actually start to produce more new collagens, new elastins, new structural components to your skin to help and slow down your aging process. So that's the basis of it. And the science is still in its infancy in terms of efficacy, but there's some very good data coming out now about stem cells. Equally, in terms of hair restoration, I think the evidence is even stronger. So I think it is something that we're going to see is going to grow and grow over the next few years. So I think it is going to be worth it's going to be worth the investment. I would suggest to you that you have a conversation with your therapist about it, as to whether or not it's appropriate for your skin type and your skin particularly.
A couple more questions, sorry. Do you have any advice on hormonal pigmentation on the face?
We see it. We have to be quite careful about it. Particularly the hormonal pigmentation we see is usually related to using the oral contraceptive pill. We see it typically on the forehead and around the mouth. One has to be very careful. It's something I think that one can never quite get rid of. You can manage it. There are things one can do to manage it. There are various products. The one that comes to mind is Abaji. But it is something that has to be done regularly. So if you're very good at ritual and very disciplined, then it's something that you can manage and live with. If you're not that sort of person, it's actually quite difficult to resolve.
If you use a topical acne prescribed cream, is it okay to use vitamin C and retinol products as well?
So topical acne prescribed cream, I'm assuming that would be an antibiotic cream. So there are various antibiotic creams out there that one could use. There's absolutely no reason why, before you apply that, you apply your vitamin C. So
and what about retinol?
Yes, but that should be a global treatment. So these are global treatments. You wouldn't just dot retinol or vitamin C onto the spot. These are treatments that you give globally to the face. And so you can certainly do that. I think you would just have to, I mean, difficult to comment not knowing what the topical cream is, but one would just need to go carefully. I would certainly, if I had to advise as to whether or not to use a topical antimicrobial cream versus something that's going to exfoliate the skin, a retinol and a vitamin C, I would go for a more global treatment first.
Can you use baby SPF products on adult skin?
Of course you can.
So to get natural vitamin D from the sun, how long should you be in the sun before using an SPF?
Well, that depends upon your skin. And you're right, it's a good question actually, isn't it? Because there is this debate around the fact that we're all using sunblocks, which is blocking vitamin D production, and then we take vitamin D supplements because we are low in our vitamin D production. And so it is a good question, I think, basically. So I think that's why I would go for a factor 30. I do think it needs to be applied if you're out more than once a day, certainly 2 or 3 times, as I've said. But I think basically after an hour in the sun, half an hour to an hour, you need to be thinking about reapplying.
So I think that's all the questions. If I haven't fielded your question because it's got lost in the chat, please do repost it and I'll do that now. But I think I've covered everybody's. Okay. Nothing else popping up? Nope, that's it. Thank you very much, David. I'll hand over to Sarah now.
Okay.
Super. David, thank you very much indeed. And also thank you very much to everyone for all the engagement in the chat and all your questions. I think one of the key takeaways is that this is a holistic approach. And thank you very much, David, for just sharing your insights and knowledge with us. That was absolutely fantastic. As we said at the beginning, we will send you a recording and a summary handout. So please do look out from that from Caroline. The other thing that we've also mentioned is that the practice is open to you for phone and Zoom consultations, and you will be eligible for to have a complimentary consultation in person once the practice opens. And fingers crossed, God willing, that will be towards the end of this month. And again, please look out on the website and keep an eye out for Naked Health about that. As David and Caroline have said, there's going to be a follow-up talk next week all about acne, covering all age groups, and particularly how to treat it effectively without having to resort to antibiotics or Roaccutane. So this talk will be free to attend. So please do visit the events page, tell your friends about it. It's a really great talk, and please spread the word. And as ever, if you do have any questions, either contact Caroline or myself. And with that, we'd like to conclude by thanking you very much for joining us, and enjoy the rest of your day. Thank you.